So ulcer is everywhere. If you have like 5 friends right now, there are chances that 3 of those your friends have ulcer or might develop ulcer in the nearest future. According to Cleveland Clinic, a very popular health blog, more than 50% of the world population currently is infected with Helicobacter pylori, the bacterium that causes ulcer. Now, the disturbing question is, why is this infection so much? Why do we have more than 50% of the world population infected with Helicobacter pylori? And how can we prevent further spread of this infection? My name is Super Mike, and for about 6 years now, I have been teaching human anatomy and physiology in 3 nursing colleges. In this video, I will answer 6 popular questions about ulcer. So the very first question is, what is ulcer? What exactly is ulcer? So ulcer is an injury. Ulcer is a sore that occurs inside the stomach or the first part of the small intestine that connects to the stomach, known as duodenum. So ulcer is just like a normal injury. It's just like a normal sore that occurs in the skin. The difference is that this particular one occurs inside the stomach or the first part of the small intestine, known as duodenum. So if the wound occurs inside the stomach, it is called stomach ulcer. If it occurs inside the duodenum, it is called duodenal ulcer. If you don't want to call them separately, if you don't want to call them stomach ulcer and duodenal ulcer, you can just call them peptic ulcer. Peptic is a Greek word for digestion, and this is because this ulcer takes place in the 2 most important digestive organs, the stomach and the duodenum. Apart from this peptic ulcer that occurs in the stomach and the duodenum, there are some other kinds of ulcers like esophageal ulcer that occurs in esophagus, mouth ulcer that occurs in the mouth, diabetic ulcer that occurs in the leg. But the focus of this video is peptic ulcer, that is the stomach ulcer and the duodenal ulcer. So now I believe you know what ulcer is. So the second question is, what exactly causes ulcer? What is responsible for ulcer? So like I mentioned at the beginning of this video, the most common cause of ulcer is a bacterium, that is singular of bacteria, a bacterium known as Helicobacter pylori. It is commonly called H. pylori or just HP. Now, if you're infected, you're going to have so much of this H. pylori in your stool, in your feces. That is why if you go for ulcer test, they will most likely give you a container to get your stool, because it is through this stool analysis that they will find out that you have H. pylori. So apart from your stool or your feces, H. pylori is also found in other body fluids like your blood and even your saliva. So, but the quantity is not as much as the one in your stool. Now, H. pylori is not the only culprit. It's not the only cause of ulcer. Another cause of ulcer is frequent use of non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, aspirin, and the rest of them. So it's not that these drugs are bad. The drugs are actually used to prevent swelling and relieve pain. But frequent use of these drugs, regular use of these drugs, long use of these drugs can prone you to ulcers. So in summary, there are several other causes of ulcer, but these are the 2 major causes of ulcer. Number 1 is Helicobacter pylori, and then number 2 is frequent use of non-steroidal anti-inflammatory drugs. Now let's go to the main question. Why is ulcer so common? Why is everybody complaining of ulcer? So ulcer is common because H. pylori, Helicobacter pylori, the bacteria that causes ulcer, is everywhere, and it is one of the easiest bacteria to get infected with, and I will tell you how. First of all, if you're infected, like I said earlier, you are going to have H. pylori in your stool. You are going to have it in abundance in your stool. And unfortunately, most persons do not wash their hands properly after using the toilet. Listen, I know this is very weird, but I must mention it. Some persons use water to wash their bum after defecation, and of course, their hand must be part of the process. Now, the problem is they wash their bum properly, but they don't remember to wash their hands properly. So if these people are infected with H. pylori and their hand makes contact with their feces, and they use the same hand to make food for you, what do you expect? You're going to have H. pylori. And this is happening in most of the public places you usually eat. So let me also mention that some persons have very long nails. People don't cut nails these days. And when they carry out this defecation process, even when they wash their hands, it is still possible that they will have some particles stuck in their nails. So by the time they use those fingers with those stuff stuck into their nails, and then they make food for you, especially the food that you don't need to wash again, like all these vegetables, all this salad, all these fruits. If they're infected and you eat this food, you will have H. pylori. So you can see that ulcer is common because the method of getting H. pylori, which causes the ulcer, is very easy. In fact, that is even about feces. Ulcer is not, H. pylori is not just found in feces. I told you it's also found in saliva. So let me talk about that a little bit. Any action that involves exchange of saliva can give you H. pylori infection. For example, sharing of spoons, sharing of toothbrushes, and even kissing. So you see, there are various ways you can get H. pylori infection. So you can see why ulcer is very common, because the bacteria, the H. pylori that causes the ulcer, is very easy to get. It is gotten through our daily activities. In fact, what I've listed here is just some of the activities. The list is actually endless. And as if that is not enough, ulcer is not only caused by H. pylori, it is also caused by frequent use of non-steroidal anti-inflammatory drugs like diclofenac, ibuprofen, and even aspirin. And some persons take these drugs almost every time. So guys, the summary of this question is that ulcer is common because H. pylori, which is the primary cause of the ulcer, is very easy to get. So the next question is, how do you know that you have an ulcer? What are the signs? What are the symptoms? What are the things that will tell you that you have ulcer? So listen, if you're always having heartburn, that burning sensation, that hot sensation in the chest, you might just be having ulcer. So that sensation is usually caused when acid from the stomach moves up to the esophagus. So it is not the heart that burns, it is the esophagus that burns. Secondly, if you're always having pains in the abdomen, abdominal pain, especially when you've not eaten, it might actually be ulcer. The next one is if you're always feeling full, that is, your stomach is always feeling as if you've overeaten, even when you just ate a little bit, a condition known as bloating, you might actually be having ulcer. If you always feel like vomiting after eating food, a condition known as nausea or nausea, it might actually be that you have an ulcer. And then most importantly, if your stool is bloody, if you find blood in your stool, it is almost a guarantee that you have an ulcer, because that blood can be due to bleeding from the wound, from the ulcer in your stomach or your duodenum. So if you notice, I've been using might because these symptoms I've just mentioned here, this heartburn and the rest of them, can also be symptoms of other diseases in the body. So they are not a guaranteed way of confirming that you have an ulcer. So my advice is, if you experience any of these symptoms, even if it's just one, visit the nearest hospital. There are various tests and procedures that are used to actually detect the presence of that sore in your stomach or your duodenum. So guys, one of the best ways to prevent H. pylori infection is to maintain proper hygiene. If everybody can wash their hands properly after using the toilet, the spread of H. pylori infection will reduce, because we all depend on each other. And secondly, you should go for regular H. pylori infection tests. So you can go for regular stool analysis. It is not everybody that has H. pylori that develops the ulcer. So if it is detected earlier, they will give you some antibiotics to treat it. Last but not the least, before you kiss anybody, make sure you know the H. pylori status of the person. Just like you know the HIV status of the person, you should also know if the person has H. pylori or not. If the person has, you encourage the person to go for treatment. So that is it. If you've learned anything from this video, please give me a thumbs up by clicking on the like icon on your screen. And if you've not subscribed to this channel, hit that subscribe button right now, because I have better videos for you in future. Thank you.